Welcome to Student Connections, where students connect with their community.
Welcome to Student Connections. Joining us today is Ms. Pam Byer, an audiologist from Lifetime Hearing Services in Marysville. The month of May has been designated as Better Speech and Hearing Month, and we want to share some important information with you. It's nice to have you in.
Thanks, it's nice to be here.
What are the most common ways that people damage their hearing?
The most common way that people damage their hearing is noise exposure. So exposing their ears to loud noise is the only control we have of being able to protect our ears from hearing loss. So it's very important to wear ear protection at all times. Mowing the grass, power tools, concerts, everything else that happens to our hearing, we do not have any control over that.
What are some of the precautions or devices we can use to prevent the hearing loss?
Muffs that you can purchase at Lowe's or Gander Mountain, and they will always have an attenuation level on them. The higher the number, so usually around 28 or 30, the better the protection. There's also custom devices that can be made, and that involves having an ear mold impression made of your ear, and then the ear protection's made to fit your ear precisely. And there are also over-the-counter ear protection devices that you can purchase too.
Are there any specific activities or promotional events taking place in the month of May advocating May is Better Speech and Hearing Month?
Well, little informational interviews like this. Nationally, there's a lot going on to make people more aware of mostly how to protect their hearing, but also to be an advocate for their hearing and being able to get in and have baseline hearing tests to determine exactly what hearing ability is. People tend to put that off too long.
Many people work in loud environments. Have employers and employees worked together in recent years to improve the workplace noise?
Yes. A government agency, OSHA, has gotten very involved, which has been a good thing. So it's mandatory now that when people work in noise levels that are high, 85 or 90 decibels, they need to wear ear protection.
Are the protective devices used in the workplace similar to the ones we mentioned earlier? And are there any others?
Those are the ones, actually, and those are probably what the employers provide. I've seen a couple of employers provide custom, which is a good thing, but mostly they're disposable ear protectors that are, I think, provided by the employers.
What types of things around our homes and in our daily lives also prevent dangers?
Lawn mowing, snow blowing, power tools. Those are the major things. Weed whacking, and I think that we just go about our normal daily lives and we really don't think about a lawnmower being loud or the weed whacking being a problem, but it can be a problem. And over the course of people's lives, doing those activities is really pertinent that they protect their hearing.
And my family and I go out shooting and we always put in earplugs.
Good, yes, that's a good thing.
For many people, teens included, music is an important part of our lives. What recommendations can you give us to enjoy music but not injure our ears?
So if you go to the concert, I would consider going to the drugstore and buying some over-the-counter ear protectors that you can just lower the sound a little bit. If you leave the concert and your ears are ringing, there's a good chance that you have done some damage.
Most people have someone in their lives that they may suspect has a hearing issue. What are some of the most common signs others may have that show they have a problem?
So hearing loss happens very slowly over usually several years, and usually it is people, friends, family, loved ones noticing the problem before the actual person. And so they will feel the person that is happening to, that people are whispering now or they're mumbling. The TV's loud, but you know, they can hear their TV, but it's loud. And so those are kind of some of the signs. Trouble hearing on the telephone.
Do they talk real loud too to hear themselves?
Often. It depends on the degree of hearing loss. More severe hearing loss people will talk loud to hear themselves. We never think about how loud we talk.
Yeah.
We talk so we hear our voices, and so that's a indicator too.
Is there a good and nice way to urge people to make an appointment?
That's a tough one, but I think a nice way to approach it is we have baseline blood work done, we have baseline eye tests done, and it's not a bad idea to have a baseline hearing test. And it doesn't mean that they're going to walk out with hearing aids. Hearing tests can determine if the person has a medical problem with their ears, and they're immediately referred to usually an ear, nose, and throat doctor. So a hearing test is a vital part of just the health assessment. People will come in and say, before I was on a certain medication, or before I had a stroke, or before I had an MRI, my hearing was good, but there's no hearing test to look at to compare.
Yeah.
So it's important to have a baseline.
Where is your office located and how long have you been there?
I've been there 20 years already, and I'm on the corner of Delaware and Gratiot. So I've been in that location for 20 years also, right in Marysville. So.
Do you work with all age groups, or do you specialize in a certain group?
I specialize more in adults than I do children. I'm comfortable doing a hearing evaluation on children 5 and up. Sometimes a little bit younger, but it depends on the information they can give me. So younger children, I will usually refer to Children's Hospital, or the intermediate school district here has a really good audiologist also, and she deals with children all the time.
How many people do you have in your staff, and what are their roles?
I have 2 others besides myself, and one's the office manager and does a lot of billing, and prior to working for me, she's been with me for about 16 or 17 years. She worked for a hearing aid manufacturer, repairing and building hearing aids, so she's my right-hand person.
Good.
And then I have somebody 1 day a week that, you know, is a receptionist, but she also can work on hearing aids too.
Good.
Yeah.
How do your patients become coming in? Do they walk in, or are they referred?
Most of my patients are word of mouth, and also repeat patients now, being there 20 years. Hopefully they like our office and come back. Doctor referrals, I work for an ear doctor a couple times a month, and he sends referrals to me. So a big part of my business is doctor referrals, people, friend referrals. I don't do advertising very much at all, so I'm pretty dependent on
Your
patient
referrals, yeah.
advocates for me, yes.
What would a typical first examination be like?
You would come into the office, and there's a little paperwork so we can get a better understanding of how they feel they're hearing and the problems they're having difficulty in. And then I will look in their ears, and based on that, sometimes right away it's the end of the appointment and they're referred to their doctor. But if that's good, then I put earphones on them. They listen for tones, and then we also do a word recognition test and test the pressure in their ears, and then we discuss the results.
Can you explain to us what the audio booth is and what you're looking for with the tone? Is that where the tones are?
Yeah, so everything's done in a soundproof room. And when they listen for tones, they're presented at different volume levels. And so that will determine the amount of volume somebody has lost. And then the next part of the test, the word recognition, is also very important because the words are presented at a comfortable listening level. So it's not always normal conversational level, but what's comfortable for them to hear. And the purpose is to see how well the ear can decipher the sounds they're hearing. Often with hearing loss, words are loud enough, but they're not clear enough.
Okay. I understand there are 3 types of hearing loss. Can you explain those to us?
So the first type would be a sensorineural hearing loss, and that is a hearing loss that is a nerve loss, and noise exposure will cause that. And it's not a hearing loss that can be fixed. So most times people will wear hearing aids when they have a nerve hearing loss. The second type is what they call a conductive hearing loss, and that is when the nerve is normal, but there's something preventing the sound from getting to the nerve. It can be a hole in the eardrum, it can be wax, it can be fluid behind the eardrum. We have little bones behind our eardrum. They can become fixated. Those are medical situations where the patient's referred to an ear doctor. The third type is a mixture of both. Some people can have a little bit of a nerve loss, but they also have something medical going on. Those two are referred to the specialist.
From a social standpoint, what is the impact of someone with hearing issues? Do they feel isolated or less active?
They do. So they become isolated because they'll go to family situations and pretend they're hearing what's going on and shaking their head yes, and giving inappropriate answers. And then pretty soon they just stop going. And a lot of the studies now are showing that it can lead to some early dementia because you are depriving your brain from hearing sounds in the environment. And I've seen that in my office where I've tested somebody with an 80% hearing loss, and a lot of people thought they had dementia, but they weren't hearing anything that anybody was talking about. So it's important to pursue and have your family and friends pursue having a hearing evaluation if you notice a problem.
Well, that's very interesting. We'll be back more after this.
Loyalty.
Teamwork.
Responsibility.
Sacrifice.
Determination.
Compassion. Respect.
I am.
I am.
I am.
I am.
I am
I am. I am.
An athlete.
Sports do not build character, they reveal it.
The American Legion. We're a powerful force for the nation. We're the largest veterans service organization in the nation. We're committed to making sure all veterans receive the benefits they deserve for the sacrifices they've made in service to America. If you're a veteran in need of help or support, please contact us. Go to legion.org to find out more about the American Legion's commitment of service to America.
The programs and community announcements presented on M6 Television are brought to you, in part, by a grant from the following Marysville High School Communication Arts Learning Partners.
Lifetime Hearing, located at the corner of Gratiot Boulevard and Delaware in Marysville. Stop by to meet Pam Beyer and her professional staff, or call for an appointment today at 364-1170. They have the expertise to help you with testing aids and assistive devices. Remember, silence isn't golden to those with hearing loss.
We're back and we're talking about hearing loss because May is Better Speech and Hearing Month. So when hearing loss takes place, what are some of the devices that can help individuals regain some of their hearing?
Hearing aids. Now hearing aids have come into the digital revolution, and so the sound from hearing aids are better than they ever have been. They're very flexible, they'll manage environments, and so many moons ago people always complained about background noise. Now the hearing aids will manage that, and they're programmed specifically to a patient's hearing loss. So they're individually programmed to help that person.
Good.
Yeah.
And I remember when I was younger, like my grandparents would have real big ones, and now I see that they're really tiny now.
They are really tiny, and most of them are very small over the ear, but there's a little tiny wire that goes into the ear canal, and they're very comfortable, which is huge. If you have to have a device in your ear, you want it to be very comfortable.
How has the research and technology advanced with patient care, both diagnosis and equipment?
For a long time, the hearing diagnosis has been the same. It's using the audiometer and the typical hearing testing. A lot of advancements have been made, though, with the hearing aids, and that's the biggest, probably, improvement. Hearing aids have improved now because they're becoming Bluetooth compatible, so that means a lot of streaming can happen between personal devices and the hearing aid, and that's very helpful and useful to people, so yeah.
Many people feel self-conscious about the large visual aids. Have the smaller equipment helped bring more people into your office?
I think that has helped, and I also think just the quality of sound people now get from hearing aids. And I think that our grandparents had, you know, it was a stigma, and now people are taking care of it at a younger and younger age because the sound is nice, and they don't want to go to work straining to hear, you know, so, and I think it's because of the improvement in technology.
Now, what are the costs for the ranges of these items for the protective ones and the hearing aids?
Well, the protective custom ear protection will be maybe about $80. Over the counter in the drugstores, maybe $5. Muffs can range probably more in the $50, $80 range. Hearing devices vary depending on, you know, I can't speak for all the dispensing practices, but between $1,200 and $2,500. And the range is the not what they look like, but how they sound. So the better technology, the higher the cost.
Yeah. With medical expenses continuing to rise, what types of insurance would someone need to help cover an exam or devices?
Medicare will cover hearing testing. Most insurances will cover hearing testing. Hearing devices, Medicare does not cover those. People who have retired from the state of Michigan, some of the union workers, those types of people might be fortunate enough to have some help for financial through their insurance. A lot of people don't, though, and it is a big financial commitment, but it improves quality of life.
Of course.
Yeah.
Are there many insurance companies offering coverage as a business person, and is it difficult keeping up with those forms and changes?
Yes, it's been quite a challenge lately with, you know, our insurance industry has changed so much, and what used to be black and white and easy, now Judy, who works in my office, has some days where she likes to pull out her hair, and it's over insurance companies. So it's a challenge. All medical offices are facing the same things.
Yeah, paperwork's awful tough.
And paperwork is tough, and they always change what they're going to cover and who they're going to cover it through. So it's evolving.
Does hearing loss affect speech development?
In children, definitely. And in adults who have acquired speech and have had normal hearing for most of their lives, they really do not have like a speech pattern that you would suspect hearing loss, unless it's a very severe loss. And if it's a very severe loss and it's been all their life, they do have a special tone to their voices, but not generally. Not people with mild, moderately severe losses. Their speech, they don't lose how to pronounce a S or a T, but children, that is why it's so important for that to be caught at an early age.
Now, schools provide speech and hearing services to families even before kindergarten begins. How is that referral made?
Well, any parent, if you're, for instance, in St. Clair County and you suspect that your child has a hearing loss, can be seen by an audiologist at the intermediate school district. And they have a sound room, and they have special equipment that makes it easier to test children. They have lights and games and different things, and a lot of times it's looking for behavioral responses.
Besides visiting your office, where could someone get more information about the hearing issues?
Well, of course, now there's a lot of online information on hearing loss, hearing aids, noise protection, anything really you want to find out, you can find it out online.
All right, thank you so much for coming in.
Thanks for having me.
Be sure to tune in next time on M6, your hometown station.